Hi, this is Leanne Kaiser, and I am talking about current event number 5 for MHA 575, the high cost of care and price transparency. This was from an article that was posted in Fierce Healthcare on February the 11th of this year. It's entitled Analysis, 30% of providers not complying with CMS's new rule on price transparency. The article was written by Robert King. So when we talk about the high cost of care, it obviously has a lot of aspects, and a lot of people are very concerned about where the country is with the cost of care and how we currently are on the trajectory of increased pricing. The United States spends more on healthcare than any other country. Until recently, many assumed that the high spending was due to greater utilization, more doctor's visits, more tests, more procedures, more ER visits, more hospitalization. However, research over the last 2 decades has proven that that is not the case. The number of U.S. doctor visits and hospitalizations procedures are comparable to those in other countries, and hospital stays are neither more frequent nor more prolonged. The root of the American healthcare problem does not lie in the quantity of healthcare consumed, but rather than its price. So, the assumption is the Americans run to the doctor every time, their toe hurts, but in actuality, it's not about the number of visits. It's about the price of healthcare in the United States. The price that we have on these services is what's driving the expense. So this graph is very interesting. If you look at the healthcare costs in the United States that has increased dramatically over the past several decades. So if you see the first number starts at 1962, going all the way through to projections of 2028. And this comes directly from CMS, the Center for Medicare and Medicaid Services, and was done most recently in March of 2020. So they're talking about the national healthcare expenditures as a percent of GDP. GDP meaning gross domestic product. The United States healthcare spending far exceeds that of any other wealthy country. The primary source of data on international healthcare spending for more than 24 developed and some developing countries is collected by the Organization for Economic Cooperation and Development, the OECD, which is based in Paris. In 2016, 17.2% of America's gross domestic product went toward healthcare versus the 12.4% in Switzerland and the 10.6% in Canada. So, if you see, we're much larger than our other organized countries in spending on our healthcare. However, utilization of nearly all healthcare types in the United States is lower or similar to that of any other OECD country. So we talked about in that first slide or two about the thought process being the visits, the number of visits was what was driving our spending. However, if you see, I just stated that it's lower or similar to that of OECD countries. So this is a busy slide, but I think this is one that kind of overall talks about things that we get concerned about when we talk about the cost of healthcare or healthcare transparency, cost transparency. So healthcare being the large part of this graph, but you talk about rising cost, insurance, economy, employers, consumers, access, products, policies, all the things that come into play when you think about cost associated with healthcare coverage, healthcare expenses, pharmaceutical reform, budgets, insurance, healthcare, plans, employers, children, all these things that are on the slide make you think about how this was going to be viewed. Hospital pricing. The average price for a hospital stay in the United States is $5,220 per day versus $765 in Australia. So that speaks volumes. When we are spending over $5,000 a day versus another industrialized country like Australia is 765. I thought that was just crazy. Whereas an appendectomy in the United States is approximately $15,930, with the next highest country being $8,009. So we are nearly double what the next country is for an appendectomy. And I think this is what, where we talk about our costs are outrageous. Our pricing is outrageous in comparison to other industrialized nations for these very same services, some of which do have a universal health care, which does impact that price or that rate of reimbursement or the costs associated. But some of these other countries that we've done comparison with in the OECD are not national healthcare based countries. So that component isn't of itself the answer or the issue. So possible reasons, when we think about some reasons for why our healthcare could be so expensive in comparison, we talk about the cost of medical education, the perceived high quality, greater choice, malpractice expenses, administrative costs, and market fragmentation. So some of the possible explanations for the increase is the things that we just talked about, the upper tail income inequality, the cost of medical education, the perceived higher quality and greater choice, malpractice, administrative costs, market fragmentation, and rent seeking. The two that are hard to dismiss are those related to administrative costs and rent seeking. Studies indicate that administrative costs can be around 30% of the United States healthcare costs. Some would argue that the high price of healthcare in the U.S. is not driven by culture or even market forces, but rather by effective lobbying on the part of healthcare providers. I can tell you healthcare providers certainly don't like the piece of administration, so that's certainly not what they would be advocating for. But when you think about some of these, let's just talk about a few of them, like cost of medical education. So when a med student gets out of medical school, 85% of them have outstanding debt. According to a statistic a couple years ago, the average medical student leaves with $157,990, with 80% of them owing at least $100,000. Whereas just 2 decades ago, which I know sounds like forever ago, but it's not, the indebtedness was $27,000. So the cost of medical education is certainly driving some of these expenses. And having a medical student of my own, I can assure you she's going to leave with more than $157,000 of debt. And honestly, I don't know in current days times how the average medical student wouldn't leave with more than $157,000 of debt. The average medical school is more than $50,000 a year. Unlike undergraduate education, there's not a lot of scholarship opportunities, and most average Americans cannot afford to write a check for their child to seek their medical education and pay cash for it. It's just not an option. So I think that statistic is going to go up even more when they do the studies to reflect our current timing. I think our current timing, you're going to see the average medical student probably leave with closer to $200,000 debt in today's times. Something else on here that I think is worth discussing further is malpractice expense. The cost of malpractice right now is through the roof. Your physicians that are in these high areas like OB, surgeons pay enormous amounts of medical malpractice insurance expense. So that's also a piece of that should be considered as a part of why the cost of healthcare is so high right now. So when we talk about the administrative costs associated with healthcare, I think this slide kind of looks, kind of represents it all. Doctors will tell you, and I've obviously worked in healthcare with physicians for 24 years and with an optometrist for 2. So I've been in healthcare 26 years, and they will tell you, and I've seen it more and more of their time is spent doing administrative tasks. Less and less time is spent face to face with the patient. It's the pre-authorizations they're doing. It's the scripts that they're writing. It's the documentation that's now required to meet the levels of service to bill the insurance companies. It's the referrals that they're spending time, sending a patient to this specialist or to that specialist and doing all the things necessary. It's the prior authorizations for medicines. It's having a conversation with an insurance company to get a test approved. They have more and more burdens now associated with trying to get the care that they need for their patients, all of which is not reimbursable from the insurance company. So they're doing that type of care for essentially no reimbursement. So that overall cost is not being covered under when they're billing for those services. So that administrative cost is huge. So price transparency. So this high cost of care in the United States led CMS to publish a new rule on price transparency. And so I think this graph was interesting when we see, the emblem for medical providers, and behind it is the shadow of a dollar sign. I think that speaks volumes in that price transparency is a concern of every American, and certainly of the United States government, and what's going to happen with our economy related to it. So CMS price transparency rule went into effect January 1 of this year, 2021. The rule states each U.S. hospital is required to provide clear, accessible pricing information online about the items and services they provide in two ways. Number one, as a comprehensive machine-readable file of all their items and services. So they have to be able to upload a machine-readable file to the internet for all of their items and services. Number two is a display of shoppable services in a consumer-friendly format. So something that the patient will be able to go out and easily shop for the service they know they need if they're doing a comparison. So the whole concept of this was to allow the consumer to be able to compare prices across hospitals, as well as estimate the cost of care prior to the service delivery. So if somebody is in a high deductible, high patient expense plan, they want to know what that appendectomy is going to cost them if they have the time. Obviously, if it's an emergency, they don't. But if they're seeking a service that is, they have a little time, they want to compare the prices, especially in metropolitan areas where they have lots of hospital choice. Here in Southern Illinois, it may not be as feasible to do a price comparison. We don't have a lot of hospitals to compare with. But if you're in a metropolitan area or an urban area that has, 6, 8, 10 hospitals, and you're going to have an elective surgery or a surgery that can be scheduled, for example, you need foot surgery, but it's not in any kind of emergent situation, you absolutely would want to be able to shop that service to see what care is provided, not only at what price or at what quality level. You want to be able to know what's going on. So in the shoppable service for the consumer-friendly format, they have to list at least 300 services that they perform. And what the CMS rule was designed for would be their top 300 services. But 300 is absolutely the minimum that they have to provide. What they're seeing thus far is, of the comprehensive machine-readable file that's been out there, is the lack of consistency in format and in content. So I think there's going to be a lot of discussion and debate and looking at how these files are being uploaded, how they're being done by each entity. So this next graph shows obviously the trajectory of the expenses and the costs associated with healthcare. When they did a survey of the compliance for the new CMS regulation, it was found that 30% of hospitals are not in compliance with the CMS rule for transparency. So the recent article that I found, published by Fierce Healthcare, indicates that approximately 30% of hospitals are not complying with the new CMS price transparency rule. The analysis done by the consulting firm Guidehouse of more than 1,000 providers across 27 states found that about 30% were not complying with either of the methods provided by CMS for pricing information. According to the hospital study, the main reason for noncompliance was the lack of resources due to COVID. So obviously this is an easy out for them to say that COVID hasn't allowed them to be able to comply. Some others are stating the lack of understanding of the rule, or they're just flat out waiting to see what their competitors are doing with it to try to replicate that. The firm did state that larger hospitals requirements of the consumer-friendly shoppable services file, they're the ones that are more likely to be able to comply. So the analysis did reveal that 60% of the providers are using the consumer-friendly file, while 48 are using the machine-readable, and some with both. The requirement says both, but some agencies are just trying to get what they can out there, and obviously some of the providers are using the consumer-friendly file as an easier format. As I mentioned before, the lack of consistency in format and content makes it difficult for anyone to gain the useful pricing information that they're looking for and the intent of the legislation. So, I think this is something we all fear is the medical bill. So when we're thinking about the service that we need or that we're trying to schedule or that we're thinking about, the first thing that comes to mind is how much is it going to cost me? It's scary. It's life altering. It can cause bankruptcy. But it also, on the flip side of that, is forcing patients to not receive the necessary health care. It makes them worse, which ultimately can mean more money if they leave the condition and have a catastrophic event associated with that. So, there are lots of folks who are looking at this from strictly a dollars and cents perspective, when in actuality their health care is failing worse, and in the end they may end up paying more. So CMS has set penalties for noncompliance. They actually have in their legislation that they can charge $300 a day for each day out of compliance. So, they're holding some feet to the fire with the funds. However, CMS has a massive task in evaluating the compliance of this new rule. It's not something that they're requiring somebody to send data on. They're just going to have to go out and actually audit those hospital systems to see if it's in place, or have someone sitting in an office and literally going to these hospital systems websites to see if the requirements are on their websites. Do they have a machine readable file? Do they have a sortable, shoppable list of services providing on their website that they can do? So yes, the money is there for the penalty, but CMS also has a lot to invest in order to be able to get the numbers of compliance and to be able to actually enforce that rule. So this next slide, I think, is what we're all looking for in healthcare. We're looking for more efficiency, better quality at lower cost. And I think, some, ask for this and expect this, although this may be a huge undertaking of the medical system as a whole. So they're asking for the transparency to try to drive prices down, but still keeping that efficiency and quality is a large task. In order to do that, we're going to need more legislation, more policies that promote pay for quality versus pay for quantity. So right now, the system is very rewarding of paying for numbers of visits. We need to be able to move more toward a pay for performance, a pay for quality, meaning a per member per month kind of philosophy for outpatient services, and insisting that we see quality in inpatient services and paying only based on that quality outcome. And that's going to take a lot of time in order to achieve that. So this is what the patient's perspective of this is. they're laid up with, in this case, what looks like a broken leg or a broken foot, and all they are is trying to recoup, and there's bills coming in and piling up for the services that were necessary to continue their health and to be healthy. So, this is where I think most of us sit on this fence, is that all we worry about is the bills and the outcomes of the healthcare we receive. So this, I think, is a visual of where we are. Article after article after article talking about healthcare costs and what's our plan to fix it and what is the government going to do about it. And everybody has their opinion of how we should move forward, both on the provider side and the patient side. But it's a complex, ever-changing, confusing situation and system. And I think it's going to take a lot to reform this system, and it certainly isn't going to be a quick process. So here are the resources and the references that I used for this presentation. I would be glad to discuss any questions that anybody has on it. And thank you very much.